Hi, I'm delighted today to be here with Dr. Steven Ruden, International Director of Education for Havening Techniques. Welcome, Dr. Ruden.
Thank you, Michelle.
Thank you for being here and agreeing to do this.
My pleasure.
What I'd like to accomplish today in this interview is to enlighten the viewers about Havening Techniques, as if they know nothing. So, what is Havening Techniques, or what are Havening Techniques?
Havening Techniques is an approach that was developed by Dr. Ronald Ruden, my brother, and with collaboration by myself, in which we've uncovered a unique aspect of the human condition. And that is that the use of touch, a specific type of touch, allows us to heal in our body and specifically our minds.
Wow,
Yeah.
very powerful, very profound, isn't it?
Yes, and actually what we've discovered is that it creates structural change in the mind that allows for those things that are stimulatory to us, that create distress, are no longer there.
Wow. And anybody that's seen Havening Techniques knows that it looks incredibly simple. However, it's not, is it?
The technique is incredibly simple.
Exactly.
The ability to find that aspect of the individual that is causing the distress is where the trick of the matter is.
Absolutely. I call it the archaeological dig to find out the information, so you know which direction to go in. So, who can use Havening Techniques?
Anyone can use Havening Techniques. However, it is used in a number of ways. It is used by licensed healthcare professionals in psychotherapeutic environments. It is used by coaches in peak performances, and it is used as a self-help methodology for those who want to improve their life and the lives of those around them.
Right. So anybody, really?
Anybody.
So for you, what is the most enjoyable aspect of a session with a client?
The most enjoyable aspect for me with a client is when that distressing moment is cleared. And you can actually see that moment in their face as that thing, that idea, that emotion, that distress that they've been carrying around their whole life somehow magically is no longer stimulative for them.
Right.
And they realize, where did it go?
Yeah.
And they look almost befuddled that what was once there is no longer.
That's so true. When they come out of a Havening session or part of it, that look on their face when they're sort of looking around trying to find it again.
Yes.
We know that we've achieved what we've wanted to achieve with them. And in your opinion, what is the most enjoyable aspect of a Havening session for the client?
I think the client then recognizes that what they've been carrying around all these years is no longer relevant.
Nice.
And they can then choose a different path for themselves, which includes those things that they were inhibited doing before. So if you were afraid of flying, now I can fly and explore the world.
Right.
If they were afraid of dogs, for example, they can get a pet. So it expands their ability in life to enjoy it to the fullest.
Yeah. Freedom of choice.
Absolutely, freedom of choice.
Love that. So what is the future for Havening Techniques?
I think the future of Havening Techniques will be that it will take its place in the world of approaches that help people achieve self-acceptance. That they will then find themselves in a place where they are more comfortable with themselves, they'll be able to interact with society in general better, and that our society in general will feel more connected.
Right. So is there anything that you'd like to share with us that I haven't asked you to do with Havening Techniques?
I think the most important thing that we find is that Havening is simple to apply, simple to use, and that all of us will benefit from reducing those stressors that we carry around with us on a daily basis.
Yeah. And what we haven't really mentioned is it's a touching therapy, yes?
Yes, it is.
And what I've noticed as a practitioner, and I believe you would agree with me, is that nowadays we don't hug each other so much. There's not so much tactile interaction because we spend a lot of time on our phones and our tablets and our laptops having virtual relationships with each other. So it's a very important part of life, isn't it, to have that healing touch.
I think some of the statistics are you need 5 hugs a day to survive, 7 hugs a day to be okay, and 12 hugs a day to thrive. So we are hardwired to be connected in that way. So yes, yeah, I think you're right.
And I think that's...
Intimacy. We're all intimate animals and people, and that we've lost that ability to be intimate, I think, to some degree.
Yeah, we have. And it's hardwired at birth, isn't it?
Yes.
As you found in the research that you've done with Havening Techniques. So we all really need it and crave it. I remember when my son was a little boy and he used to watch TV and say, "Stroke my arm, Mommy." And I didn't know about Havening Techniques, but now it all makes perfect sense because it totally relaxed him. And he just felt great.
I think it's all about connection.
It is. It is. This has been great. Thank you so much for enlightening me and our audience. And I wish you all the best, and we look forward to the future of Havening Techniques.
Wonderful. And just as a final note, for people who are interested, they can go to our website where there's literature and research and documents at www.havening.org.
Great. Okay. Thank you very much. And thank you all for watching.